One happy Easter weekend to everyone. This is Dr. Moreau with Cause l'école. Today we will talk about health disparities. Health disparities. We'll go about the definition, the causes of it, who's mostly impacted by it, and the impact in the community, and what can we do to deal with health disparities. But before I do that, I'm going to share a live with some of you, and I'm also going to go over what we did last Saturday. Last Saturday we spoke about the 3 types of stress, and we also talked about the 3 stages of stress. So we encourage you once more to go and review our videos, our lives, so that way you can put in practice those videos, because we believe we've provided you with invaluable information. So once again, Cause l'école is here to inform you, to provide you with invaluable information, and we encourage you to continue to review our videos. Today we will talk about health disparities. So what is a health disparity? According to the CDC defines health disparities as preventable differences in the burden of disease, injury, violence, or in opportunities to achieve optimal health experience by socially disadvantaged racial, ethnic, and other population groups or communities. So the CDC, which is the Center of Disease Control, they define health disparities as preventable differences in the burden of disease, injury, violence, or in opportunities to achieve optimal health experience by socially disadvantaged racial, ethnic, and other population or communities. So that is the CDC. Another definition I have for you is from the Healthy People 2020. The Healthy People defines health disparities as a type of health difference that is closely linked with social, economic, and or environmental disadvantages. So the Healthy People define health disparity as a type of health difference that is closely linked with social, economic, and or environmental disadvantages. So what populations are mostly at risk for health disparities? We have the chronically ill or disabled, the low income or homeless individuals, certain geographical communities, the LGBTQ plus population, and the very young and or the very old. So these populations are most at risk for health disparities. According to the Office of Minority Health, African American are at a higher risk for heart disease, stroke, cancer, asthma, influenza and pneumonia, diabetes, and HIV/AIDS. So African American are at higher risk for these diseases: heart disease, stroke, cancer, asthma, influenza, pneumonia, diabetes, and HIV. So what are the common health disparities? So the common health disparities are mortality, life expectancy, burden of disease, mental health, uninsured or underinsured, and lack of access to care. So these are the most common type of health disparities, right? So examples of these most common type are depression, food insecurity, and race. So these are examples of the most common type of disparities. So what causes health disparities? What are the causes for health disparities? So many factors contribute to health disparities. So these factors include genetics, access to care, poor quality of care, community features, for example, inadequate access to healthy foods, poverty, limited personal support system and violence, the environmental conditions like poor air quality, language barriers, and health behaviors. So all of these are factors that contribute to health disparities. So genetics, access to care, poor quality of care, community features, for example, inadequate access to healthy foods, poverty, limited personal support system and violence, the environmental conditions like poor air quality, language barriers, and health behaviors. So, moreover, bias, stereotyping, prejudice, and clinical uncertainty, all of them contribute to racial and ethnic disparities. So bias, stereotyping, prejudice, and clinical uncertainty also contribute to racial and ethnic disparities. So what are the effects of, now that we just saw what are the causes of health disparities, so what are the effects of health disparities? So health disparities rob individuals of good health and their sense of well-being, right, and personal security. They deprive communities of human resources and money. They drive up costs. They decrease productivity, and they diminish the quality of life for everyone. So the effects, the impact of health disparities are robbing individuals of good health and their sense of well-being, personal security, deprive communities of human resources and money, they drop off cost, they decrease productivity, and diminish the quality of life for everyone. So the US government, for example, spent 309 billion, loses 309 billions a year because of health disparities. That money could have been put in use for other social services, but in turn they have to use that for toward health disparities. So how can we reduce health disparities? So health disparities can be reduced by improving access to high quality education, early childhood interventions, and parent support programs. So we can reduce health disparities by improving access to high quality education, early childhood interventions, and parental support programs. So this is how we can reduce these health disparities. So in order to solve, we can reduce it, but how about solving it altogether? How can we solve health disparities? So we can solve health disparities by focusing on communities that are at greatest risk, increasing access to quality health care, increasing the workforce capacity to address those disparities, by supporting research to identify effective strategies to eliminate disparities, and by standardizing and collecting data to better identify and address disparities. So this is how we can solve this health disparities situation. So focusing on communities at greatest risk, increasing access to quality health care, increasing the workforce capacity to address these disparities, supporting research to identify effective strategies to eliminate these disparities, and standardizing and collecting data to better identify and address these disparities. So we believe if we do all those things, we will solve altogether the health disparity issue. So again, we saw that we saw the definition of health disparity. It's a type of health difference that is closely linked with social, economic, and or environmental disadvantages. So we saw what population are most at risk of for health disparities. We saw it's chronically ill and disabled, the low income or homeless population, certain geographical communities, LGBTQ community, and the very young and the very old. So these populations are most at risk for health disparities. So we also saw that African American are most at risk for heart disease, stroke, cancer, asthma, influenza and pneumonia, diabetes, and HIV/AIDS. And the most common type of health disparities are mortality, life expectancy, the burden of disease, mental health, uninsured or underinsured, and lack of access to care. So these are the most common type of health disparities. So what causes health disparities? We saw it had to do with genetics, access to care, poor quality of care, community features such as inadequate access to healthy foods, poverty, limited personal support. So all of these are causes of health, cause health disparities. And we saw that we can reduce health disparities by improving access to high quality education, early childhood interventions, and parental support programs. So we know there are many communities, even here, right here in South Florida, we do not have parental support programs. We do not have enough early intervention programs for our children, and we do not have high quality education in all of our schools. So even though we are in the same district, there are many schools with higher quality education for these students. So again, to solve health disparities altogether, we need to focus at these communities that are at greatest risk, such as the LGBTQ community, the elderly, the disabled, the Black community. So these communities are at greatest risk. So we need to focus more. We need to put more resources. We need to increase the workforce capacity to address these disparities in these communities. And if we do all that, then we will solve the health disparity. And last thing I want to say is regarding mental health, we have a mental health center. So our mental health center is called Family Empowerment Mental Health Center Incorporated. So you can reach us at 305-952-8931. We have a well-qualified staff, and we know that this is a health disparity. So we are giving you access to our mental health center, and we do accept many different types of insurance, including Aetna, Blue Cross Blue Shield, Humana, Cigna, United Health, Bright Health. So give us a call, because it's time for us to eliminate the stigma of health, of mental health, because mental health is also health care. So this was Dr. Moro Fokozele Call. Thank you for watching. Enjoy the rest of this weekend. Enjoy Easter Sunday, Easter tomorrow. Go to church, pray, thank God for being alive, and I will see you next Saturday.